Good morning. My name is Curtis Jackson. I am a vice president with the Alberta Union of Provincial Employees. I am also the chair of AUPE's Standing Committee for Anti-Privatization. This morning, I want to talk to you a little bit about the privatization efforts that have been going on in Alberta within our healthcare system. I thought first I would start out with a brief definition and description of what privatization is for those who are unaware. The Cambridge Dictionary defines privatization as the act of selling an industry, company, or service that was owned and controlled by the government, so it becomes privately owned and controlled. Control is the central issue in privatization, especially when it comes to healthcare. When the public controls our healthcare, when it is run by us and for us, services are accountable. When government has control of services like healthcare, the accountability rests with the elected officials. When services like healthcare begin to decay, the elected officials can realistically be held accountable in future elections or even be subject to recent recall legislation. It is a fundamentally democratic endeavor. When services are publicly operated, we can choose the government we believe best manages our vital public services. When control of services like healthcare are sold to private corporations, the elected officials say that they are no longer responsible for decisions that are made. Control of those services now belongs to the corporation, and in the case of publicly traded companies, the shareholders that can afford to own part of those companies. Decisions around how services like healthcare are delivered and therefore no longer in the purview of the public paying for the services. Instead of being accountable to ordinary citizens, corporations are only accountable to those fortunate enough to own shares. The entire purpose of owning shares is to make money, which turns a public service into a profit-driven machine. We have seen a number of disasters regarding privatization within our healthcare system as of late. The first one I want to talk about really quick is the Dynalife disaster. The private company Dynalife was successful in winning the tender to provide lab services in Alberta, but it quickly became apparent that Dynalife was woefully unprepared to meet the demand for laboratory services. Staffing levels were dreadfully low, and Dynalife ultimately failed in its commitment to providing contracted-out laboratory services. Publicly controlled Alberta Precision Laboratories began taking control of laboratory services back into the public domain. The government originally claimed that it cost $31.5 million to bring it back in-house, but we later found out it cost $100 million. We also learned that Dynalife was struggling long before the government gave them control of laboratory services. The corporation faced insolvency within 3 months of receiving that contract. I also want to talk about the retail food services disaster. Retail food services in our hospitals used to be provided as a service. Cafeterias exist in hospitals to provide a place for family and friends of patients to meet their own needs while they support their loved ones through their healthcare journey. Staff also rely on hospital cafeterias. Paying more money for less food is the last thing you should worry about when you're supporting your loved one through surgery, treatment, testing, and diagnosis. But that is the reality that a for-profit retail food enterprise creates. Staff and patients have reported this exact scenario since the government ordered AHS to sell off its in-house non-patient food services. Private hospital food services are built to take more money from the pockets of already burdened Albertans who are often experiencing periods of high financial and emotional stress. I also want to address the Medicare disaster. We are learning more every day about how contracts have been awarded for private surgeries, as well as imported pain medication. Millions of dollars of public health care funding have been written off as a result of bad decisions being made in contracting out, including the privatization of surgeries, which we are already starting to see the ramifications of. The Alberta Surgeons Group charged over $8,000 for a $4,000 knee surgery. The same is true for hip surgery, and shoulder surgery is even worse. That is literally the opposite of saving money. But don't worry, Premier Smith appears to have gotten the price down to closer to $7,500, still more than double for a shoulder surgery. We still don't know why Premier Smith would do this. Was it ideology gone wrong, so she was unable to see the wasted money? Or did free hockey tickets entice her to wasting taxpayer dollars? We just don't know. How else could these losses seem acceptable to Premier Smith and her cabinet? To this day, there has been absolutely no accountability for this. This all brings us to KBRO and privatized hospital laundry services. Most cheerleaders for privatization say that private companies are more capable of finding efficiencies. In this context, efficiencies is a buzzword for cheaper labor and cheaper production. Conservative governments often compare public sector wages and private sector wages, using the comparison as a rationale to deny wage increases to public servants. But this hypocritical viewpoint actually argues in favor of maintaining public service. Private companies seek to increase profits from public dollars by cutting costs, including to the people who make up their workforce. Whether they seek efficiencies by keeping wages low or reducing the quality of the product or service, we can call it what it is: cutting corners to the services we all depend on to make themselves lots of money. The UCP government said private hospital laundry services would save Albertans $200 million. $200 million was Premier Kenney's high estimate for repairing and replacing broken and old laundry equipment. However, the AHS Performance Review Proposed Implementation Plan from August 13, 2020, quoted an investment of approximately $38 million to $42 million to upgrade and maintain a reasonable number for so much vital equipment. We've discovered that the contract with KBRO is now costing the province significantly more than in-house laundry services had. The information handing our healthcare laundry services to KBRO has been an absolute disaster. AUPE members working in healthcare have experienced countless incidents of soiled linens and lost items stuck in the clean laundry that they receive. Hospitals have even resorted to purchasing washers and dryers to wash valuable items that KBRO allegedly lost, such as lift assist straps. Items like these straps cost over $1,000 to replace. In short, the information we have indicates not only is KBRO costing this province more, it also cannot effectively provide the services it has been awarded the contract for. This failure to provide Albertans with clean linens and return items sent for laundering is not what we should be paying for. There is a solution. Bringing laundry services back in-house would significantly reduce the costs moving forward, which would also offset the costs of equipment repair and upkeep. It would also put a stop to the Americanization of our healthcare system. Handing over laundry services alongside retail food services so far is just one step towards making other, more obvious aspects of our healthcare system into for-profit enterprise. It's time for the government to step up and keep it clean. There are further potential disasters as we move through the plan to refocus healthcare in Alberta. Despite claims that the refocus of healthcare is not privatization, the extensive references to early plans to contract out is in fact privatization. Minister Lagrange and Premier Smith struggle with the actual definition of privatization and are confusing this term with privately funded healthcare. The greatest struggle that Albertans face appears to be uneducated politicians who don't seem to understand the basic tenets of privatization or what the word actually means. What is worse, those same politicians who have no actual experience working within the publicly delivered system are the ones pretending to know how to fix it. Dirty stories continue to surface around who is being awarded contracts and what their connection to the government is. The more Premier Smith talks about privatizing or contracting healthcare money, the more you should expect to lose. AUP members working in publicly delivered healthcare are some of the most undervalued and ignored workers in our province. But in fact, they are one of our greatest resources. We must invest in them and invest in the services they provide. The government must stop looking for fixes to our healthcare system by lining the pockets of for-profit corporations and CEOs who take them to hockey games. Before I open to questions, I will end by inviting Premier Smith and Minister Lagrange to a playoff game, my treat. Unfortunately, I'm not the CEO of a private for-profit medical corporation, so I cannot afford luxury boxed Oilers seats. Instead, I would gladly pay for tickets in Premier Smith's constituency of Medicine Hat to watch the Medicine Hat Tigers battle the Lethbridge Hurricanes in round 1 of the WHL playoffs. All I ask for in return is to spend intermissions talking about the need to protect public health sector jobs. This is my invitation to both of you to keep it clean. Thank you. I'll open to questions.
Hello.
Hello.
Hi. Charles Lyle, Radio Canada, Alberta. So I guess my first question is, after all this, what are your concrete asks to the government? If you could just
Absolutely. So we know for a fact that it was not the current cabinet that made the decisions to award the contract to K-Bro Linen Services. What we have in front of us is an opportunity for Premier Smith to show that she actually respects jobs in this province and workers in this province, that she has an interest in fixing the wrongs and bringing linen services back into the public domain. Doing so would create hundreds of jobs in the healthcare services, as well as create rural jobs that are desperately needed at this point in time.
Mm-hmm. And you mentioned that it's profit driven. Can you kind of walk me through, for someone that doesn't know this linen world in the healthcare industry? Kind of, how does it work? What are we seeing?
Sure. I'll pass that off to one of my committee members. So we have LPN Angela Smith here today that will tell you what it looks like firsthand.
Hi, I'm obviously not as tall as Curtis. I'm Angela Smith. I'm an LPN, and I've been working with AHS for 41 years through the Canmore Hospital. Now, since K-Bro took over, it has been hard to give quality care when you don't have quality services. When you take a sheet that is called a slider sheet to put under somebody's bottom to slide them up in bed, and you unfold it, and it's full of feces, you don't know what to do. So you just take it away. I did take a picture of it. I sent it to OHS and to Human Resources, both AHS and AUPE, and told our CEO and everybody about it. I got a response back, why are you sending this to us? Well, it's quality control, and also it's infection prevention control. We cannot give our patients face cloths and towels on a daily basis, because if we do, we get charged per item over what they decide we deserve per week from K-Bro. So with that soiled sheet, it was a choice whether I just threw the one sheet back in the laundry or put the whole cart back in the laundry. If I put the whole cart back in the laundry, it's going to cost a fortune to the Canmore Hospital for to pay for every face cloth, every towel, every gown, every sheet that's on that cart. So we had to use it. These are folded sheets that come from K-Bro. Our face cloths and towels that we used to have were nice. They were soft. They're now like fine sandpaper. Mm-hmm. So you don't even want to give them to your patients, but you have to. Our patients do go 3 days with the same towels and face cloths because we cannot afford to give them any more than that. So it's costing $6 million a year more for decreased quality of care to our patients. We, as you know, feel really crappy about this, no pun intended. But what else can you do? I also, when COVID was at the highest peak on acute care, because that's where I work, we had 6 COVID patients. I had to go and find gowns for us to enter the rooms because we had no disposable gowns. We had no isolation gowns. So I took a cart and I was borrowing off the other carts. I was given hell by K-Bro saying, what do you think you're doing? I said, well, it looks like I'm borrowing gowns from other carts because we need them on acute care. He told me I couldn't do that. And I told him, you can't stop me. And I went around and I borrowed the gowns. He was going to report me, and I made sure that he had my name spelled right, SMYTH, so that he could report me. Mm-hmm. Obviously he didn't, or if he did, it went nowhere. Mm-hmm. So you can imagine what it's like. We have lost thousands of dollars in slings. We never did, luckily, send our long-term care residents clothes to Cabro because our management decided that they could not have our washer and dryers, whereas other sites, they took them. And so we luckily had ours where we could continue doing it and didn't have to purchase it. So
Interesting.
don't know what else I can say, but I would really, really love our laundry back.
You kind of alluded to it, like, so Cabro is aware of these concerns that people have
Oh,
in,
yes.
yes? And have they said anything to address the issue, or is
No.
it radio silence?
There's radio silence. We've heard nothing.
Okay. And you mentioned like it's more work, because one of my questions was if you think like offloading work in the private sector might help actually improve what you're doing on the ground and in the field. But you already kind of answered that. I was just wondering maybe if you could touch on that some more. Someone could.
Well, it's definitely not less work because we have to go around stealing from other carts that aren't fully used. So it's taking time out of my nursing duties to go and find linen for my area on acute care. And I'm not the only area that has to do that. Long-term care, we're attached to a long-term care. They have to do the same thing. If we go and get an extra cart from downstairs with our master key, we're charged for that cart. So we only ever do that if there's no linen left in the hospital.
Thank you.
Thank you.
I would just follow up by adding, I'm not a laundry expert. I do my own laundry though, so I'm a laundry amateur. I do know that really there's only 3 ways a person can find efficiency in doing laundry. One is to overload your machine, which doesn't get your linens clean. A second is to use the wrong temperature of water, which can affect how clean your linens become. And the third would be to not use the appropriate amount of detergent, which also affects how clean the linens become. These are 3 major ways in which I can think of to find efficiencies in laundry services. So at the end, what it results in is poor quality of service and more dirty linen.
You also mentioned like Dynalife and what other stuff? Dynalife, the food in-house in the hospitals and whatnot. To me, it sounds like your main concern is it's like death by 1,000 cuts, maybe. Does that make
Absolutely.
sense?
That is a perfect way of putting it. Death by 1,000 cuts. We are seeing continued attempts to privatize, and we are not seeing good outcomes in any of these situations. We are seeing multiple news stories every day about how contracting out is failing our province, but yet we have politicians in this province that are doubling down on continuing to contract out. They are gutting our publicly delivered healthcare service. They are taking away jobs. They are costing Albertans millions of dollars. And my biggest question to them is why? Why do you continue on this ideology of privatization and contracting out and selling our healthcare services to the highest bidders?
Kind of all the questions I had. I don't know if there's
Thank
anything
you.
else you'd like to add or I missed or anybody else.
Thank you very much. Are there any other questions?
Hi, I'm Madison. Just following up, I guess, on what you've said. So, if we've decided that privatization of healthcare is, or I guess if we've discovered that privatization of healthcare is more expensive, and it gives worse services, then why do you think that Danielle Smith is still doing this? It doesn't make sense.
Honestly, I don't know. I don't know whether it's ideology, whether the government is being tricked by corporations, whether there is some sort of pre-existing relationship that exists between the people being awarded the contracts and the politicians themselves. I have no idea. I do know that inquiries are the only way to get the answers to this, and open public inquiries are the only ways to get answers to these questions.
Thank you.
Thank you.
Hi, Matthew. It seems to me that this sort of like privatization journey, and this is like building off a previous question, it isn't going to stop. So like looking forward, I suspect there'll be more privatization in healthcare. How far do you see this going? I mean, are we looking at a situation where we could be looking at like the sales of hospitals, or like, the full-scale Americanization of healthcare? How far do you see this?
Well, this is privatization. So this is the first step in creating an Americanized healthcare system in Alberta. One thing I will point out is all you have to do is read a research paper that Danielle Smith herself wrote for the University of Calgary in 2021 before she became premier. She used the words patient-centered system to describe her approach to getting people to pay out of pocket. Right now, she's developing patient-focused funding, which sounds a lot like that as well. If we believe that paper that she wrote, then the next step is turning the government into a public health insurance company, which includes schedules of deductibles, followed by cuts of services.
Okay, thank you.
Yeah. Okay, any other questions? All right. Thank you very much, everyone, for coming out. We appreciate your time today.